Hello, everybody. My name is Dr. Deborah Morton. I am from Cal State San Marcos, along with my other colleague from Cal State San Marcos, Christina Holub, and our colleague from San Diego State, Dr. Kristen Emery. All three of us are going to be talking to you today about our COVID-19 vaccine hesitancy survey that we did this past summer. So let's get started. Next slide. So the origin of this project comes from our MPH program at Cal State San Marcos. We have students who have to do a 180-hour internship, and due to COVID, all the internships and the communities were canceled. So the faculty were asked to do some internship projects. So I came up with a project that I would get with students, and we would create a vaccine hesitancy survey, because during this real-time experience of a pandemic for public health students, this is a pretty unique opportunity. And I thought we would do a survey before there is a vaccine for COVID instead of after there's a vaccine, like most studies are done, to figure out what went wrong and why people didn't get the vaccine. So we thought we'd do it ahead of time. So we got together with students, and then with Dr. Emery and some of her students as well. And we developed a survey. It has quantitative information, qualitative information as well. I will be talking today about the quantitative information. Drs. Holub and Emery will be talking about the qualitative information. So this work is based upon the work of Dr. Heidi Larson, who in 2015 created the working group for global vaccine confidence studies. And in the process of that, which was a worldwide effort to do a survey that's appropriate for all different countries around the globe. So they worked on that very hard for a long time. The first paper was published in 2015, and it was a WHO UNICEF working group, so people from all over the world. And the things that they looked at were immunization behavior, recommended schedules, like if you have to get two vaccines, if you have to get two doses of the polio vaccine, or whatever it is, what was the overall hesitation of people, some of their beliefs about safety, efficacy, and possible side effects. And don't forget, this is everywhere in the world, not just the Western world. So, and their general attitudes, public trust in medicine and in doctors. And some of their main results was that there is a really high lack of trust. People feel like they are not listened to, that scientists are elite and inaccessible, that there are profit motivations by the pharmaceutical companies, and that there is also unregulated communication on social media, which promotes a lot of times a lot of misinformation. And then there are the anti-vaxxers who actually have big recruitment on social media. And since 2015, then Dr. Larson has published a lot of papers, and then now there is a book which she published in 2020, which is stuck over there. It's a very interesting book. It's written for the general population. Okay, next slide. Next slide. Okay, so the topic areas that we came up with to put into our survey were topic areas that we got from Dr. Larson's work and some other people's work as well. So the main thing we wanted to look at is the hesitancy for a future COVID vaccine, one that doesn't exist yet. What would the barriers be? Cost, fear, distrust, availability, time it takes to get the vaccine, the convenience of getting the vaccine, the distance that you might have to go to get the vaccine, and beliefs about your own risk. Then some questions about trust and sources of information, community leader support. Will the vaccine be equitably distributed for all people, or is it going to be, just given to some people? Then we asked them about their proximity to COVID, because sometimes if people have no understanding of the disease itself, if they don't know anyone who's sick or has died from it, then they may have a different attitude about vaccines. So we asked them some questions about their proximity and their experience. We asked them some transmission questions and COVID knowledge. Then history of their own vaccine behaviors themselves. Are they people who get vaccines or are they not? Then we asked them about testing, COVID testing, antibody testing, then some open-ended questions on life and family changes, and some other questions about coping and preventive behaviors during the pandemic, and then of course, demographics. We will not be presenting all of that today. What we're presenting today are preliminary results. So next slide, please. So we launched this project, we got the survey done, we got it launched in June. So remember, that's pretty much kind of at the beginning of the epidemic, though we know that it was here in this country probably in November and December prior to that in 2019. So the recruitment was done by Cal State San Marcos students and SDSU students online. And they sent out, announcements and all kinds of things to try to get people to answer the survey. And things were going really, really well. On one Monday, a couple weeks later, maybe about 3 weeks later, we had 367 people about noon. And then about 4 or 5 o'clock, we suddenly had over 1,000 people. And we were shocked at what was going on. So we started looking at some of the responses, and lo and behold, we had gotten infiltrated by anti-vaxxers. And we could tell that they were anti-vaxxers because of the way that they were answering the questions. They were bent on giving us answers that were inappropriate, such as, how old are you? Oh, I'm 100 years old. Or that's an ageist question, so I don't want to answer that question. And they just continued to answer questions in a very obvious way that they had a motivation to just give us information that was way out of line. They did answer some of the questions, though, that are in their interest about anti-vax things. They did answer those questions in a way that was pretty consistent, but the rest of it was obviously kind of purposeful to kind of mess up our survey, I would say. So we will not be looking at any of that data today. We shut the study down to stop them from being in our study. When we shut it down, which was only at the end of that week with a few days, we had over 6,000 responses. So they really came after us. And then, so we have that data, and at some point we will be looking at that, but that is not what we're going to show you today. So our final sample size, then when we stop the survey for good in November, at the end of November, I mean at the early November. So we've only had about 5 weeks to look at the data yet. Our final sample size is 576 people. And these, what we're going to show you, are preliminary results. Our future plans for this study will be, of course, to do more in-depth analyses, get some publications out there, and hopefully find some funding so that we can do a second round and do a second survey to see how things have changed. Next slide, please. So we had a total of 576 people, 426 women, 140 men. That's about 75% women. Most people were from California. There were people from 37 other states. That was 15 of them. So that was about 70% from California. Mean age of the respondents was 36 years. Most were white, 58% were white, 24% Hispanic, 16% Asian Pacific Islander, and then the other two groups were like 13 American Indians and 13 Middle Easterners. The education level of the sample is very, very high. So over 64% of people had a bachelor's degree or higher, and about 28% of those people had PhDs and master's degrees or MDs. So that about 23% had some college, and about 11% were high school or less. So I would say this sample has a very high level of education. Okay, next slide. So I'm going to talk to you about some charts and that I've done. I took the overall data because the first thing we're interested in is their personal overall hesitancy. So the question was asked, let me make sure here, if personally considering getting the future COVID-19 vaccine when available, what category would you place yourself in right now today? So one category was I would refuse. Those are the refusers on the right. And then I would be hesitant or unsure. That's the group on the left. And the other three were they would either get the vaccine immediately, sometime in the future, or if it was required. So that's how those three groups were categorized. And that's how I'm going to show you the rest of the data that you'll see today from the quantitative part of the study. Okay, next slide. So here's gender, and you can see, like I said, there were more women than men, but it was similar for each of the three groups. It really wasn't significantly different for any of the groups. Next. You skipped one. Okay, there. So this is where people came from. Most came from California. And once again, you can see that for each of the three groups, it was pretty much the same. Next. So this is the age. Now, age was significantly different. So if you look on the left group, the hesitant, unsure group, you can see that each of those age categories were pretty evenly distributed. And then if you look at the ones who will get it immediately or in the future, there were more older people in that group. And then in the refusers group, they really had, most people were 35 or over in that group. So this was significantly different. So meaning that the refusers were significantly more likely to be older. Next slide. This is ethnicity. So once again, you can see in the hesitant, unsure group, they're very similar to one another. In the immediate group, the white group was more prevalent in that group, and the Hispanic group lower in that group. And then in the refusers group, which I find very interesting and a little bit scary, the highest group were the Hispanics and the whites, which I would expect, but not the Hispanics. So I think that's some pretty interesting information from this already. Okay, next slide. So this is the education level. And like I said, this is a pretty high level of education. And the first two groups have a similar distribution. And then the last group, there are a little bit less who were high school educated, and then a lot of people who had a BA or a BS degree, and then in the refusers group, and then a master's or higher. So that's interesting as well. Okay, next. So these are some of the barriers that we ask questions about. They're up there on the right-hand side in the legend, if you can see those. And so if we look at the first group, the hesitant, unsure group, we can see that the highest one was cost. So those people were worried most about the cost, and then second about fear of infection from the vaccine. So that's pretty interesting. And then the group in the middle who said they would get the vaccine, most of them said that the choices that we had there for them to say that it would be a barrier for them, they didn't like any of those choices. And I think Dr. Emery will be giving more information on that in the qualitative data. But most of them were concerned about the cost, and the other things they were not concerned about. Then the refusers, this makes perfect sense. Most of them were concerned, or their barrier is that they distrust medicine and other, anything that's medical or government public health things. So that was the highest one, and the second one was that we didn't give them the choices they were interested in. So, and then none of them said anything about, let's see, distance to getting it, time needed, or the wait time at the site. And that makes sense because they have no intentions of getting the vaccine. Okay, next. So these are the proximity to COVID questions. We asked them if they themselves had had COVID, and you can see that's in the blue columns that across the three groups, it's fairly similar, that it's about 4% to a little over 4% that had COVID. And remember, this survey was done mostly during the summer in July and August, and then we had a little bit of we didn't have a lot of people answering, and then people answered more in October and towards the end of October. And then there were a lot of people who said they think that they had it, but they weren't sure. So that's kind of interesting too. Okay, next. So this then is, did you know someone? And if you did know somebody, were they hospitalized? So the blue bars are if they knew someone who had COVID, and then if they were hospitalized. And for the three groups by itself, they across the three groups, those distributions were similar. So it doesn't say much about the refusers. Okay, next. So this is more information about the people that they knew. So, so the blue bar on the left is if they knew someone who had died. So you can see that's sort of similar, but less among the refusers. And that was right around 28 to 32%. And then the yellow bar, which is fairly high in the three, which went from to the left, it was higher and then lower and lower. That is that they had a friend who had died. And then the turquoise bar is if it was a relative. And then the other two were COVID co-workers or patients. So, and that was less. Okay, next. Next slide. Okay, so we asked if they were tested for COVID, and you can see the testing really hadn't probably ramped up much back then. So it was about maybe 26, 27% in the first group, and right around the 25%, and then lower about 20% for the refusers. And then were they also tested for antibodies? That's the other bar. And a lot of them were not tested for antibodies, but the refusers were higher there, getting tested for antibodies, thinking that they might have had it. And there wasn't a lot of places you could go to get antibody testing while this survey was going on. And that, of course, has changed. Okay, next. And then this is where they were tested. So the blue bar is at a free clinic or a COVID site. The middle bar is a healthcare provider. And then the other bar is county public health. So in all three of these groups, it seems, and especially in the refusers, people were not going to county public health to get tested. They were mostly going to a site set up for COVID, and then in between, there were people who went to their healthcare providers, and that highest group was in the refuser group. Okay, next. And this is where they got their antibody testing. So you can see that there was more antibody testing at county public health and more antibody testing for the first two groups at the healthcare providers. So that's all I have in our quantitative data. Quantitative data. Oh my God. So I hope that we can do some other more advanced analyses and come up with some sort of risk profile for who we think will be getting a vaccine from this survey and who might really not have anything to do with it. So now Dr. Emery is going to take over, I believe, and give us some qualitative data.
Hi, everyone. So now I'm going to switch gears just a touch and kind of supplement what Dr. Morton has been speaking about with our qualitative data. So the purpose of qualitative data is really to gain insights into the lived experiences of participants or of humans. So we kind of take their own words and we quote them exactly as they're stated, okay? So you're gonna see some stuff that might seem a little controversial. That's okay. It's not our opinion, it is the opinion of our participants that we're sharing with you. We did this at SDSU with a team of 6 researchers. We established intercoder reliability for the items, and then we coded all qualitative responses for themes, and that's what you'll see here. So yeah, we'll go ahead and go forward. One question that we asked surrounded the idea of reasons why people might not vaccinate their children. And the responses we got were quite interesting. They surrounded around the topics of anti-vaccination movements, so just generally anti-vaccination, lack of trust in the government, in media, as well as science, and a belief that children are actually not susceptible to COVID-19. And finally, one that we're all heard a lot about, insufficient testing. So we'll explore some of the actual quotes participants said in this topic area. So as far as anti-vaccination movement and lack of trust, this participant said, there are shifting attitudes towards vaccination and negative portrayal of vaccines in the media will affect the total number of children who will inherently receive the vaccines, meaning depending on how this is portrayed and dealt with by the media as well as by our politicians, people will behave likely differently. This is a large quote that I'm going to break down for you because it's just too much to go through in kind of one big chunk. This person said, the public has grown to distrust science behind vaccines and the government. So that's problematic, right, if people aren't trusting these basic things. We are so brainwashed by the media that we can't tell what's true and what's false. Also, we are discovering that a lot of what the government and Board of Health has recommended or required is in fact fueled by political funding along with inaccurate or false information, so information that can't be trusted. I'm a mom that vaccinates. However, with all of the vaccines coming out that have terrible adverse effects, along with an extremely low situation that my child would even contract the specific disease it's supposed to protect them from, I do not trust this new COVID vaccine. I will not be giving it to my child. And just to kind of tie this together, as Dr. Morton mentioned, this data was collected prior to basically the summer, prior to the election and all of that. So people might be answering slightly differently as things progress, as the vaccine that we know is now being launched in the UK is happening. So just keep in mind this data is a little bit dated and COVID's moving very fast. So anti-vaccination movement and lack of perceived risk for children is a continued theme throughout the respondents' responses. This person said, the illness is not affecting children. There is no proof the vaccine will prevent illness in children or adults. Vaccines don't stop the spread of illness, even if people think by giving it to children, it will keep adults from getting sick. The potential known dangers far outweigh the benefits. There are no proper independent scientific studies being done on the vaccine. And so here there's some accurate information and maybe some false information, but this is things that people believe. And so we need to understand what people actually believe in order to kind of address this from a public health perspective. So even understanding that there's this lack of solid information about what's going on is helpful to us to help address the issue. Oh, sorry, I went through this already. The theme of the efficacy of the vaccine trial and insufficient testing for the vaccine was by far probably the biggest issue people had. So even people that are pro-vaccine were very worried about insufficient testing. This participant said, I do not believe enough research has ever been done on vaccinations and a possible side effect, specifically related to the COVID-19 vaccine. Another participant indicated, I like to wait at least a little while when new medications and/or vaccines are created to ensure the safety of a new product before, sorry, I have to read this, before putting myself or my family at risk. So again, this idea that vaccines may be unsafe or not, or less safe than actually contracting COVID is a concern that our participants expressed repeatedly. Another theme that we addressed is why it might be difficult for some groups to get the future COVID-19 vaccine. Oops, pardon me. Themes that our participants came up with were surrounding culture and religion, inequity and systemic discrimination, as well as immigration status of individuals. This participant indicated that vaccine manufacturers prey on minorities, so I do not believe they will have a problem getting it. I believe they will be forced to get it if they are on any type of government assistance. And so the discrimination is kind of in the reverse direction that we were kind of anticipating people to come up with. Another participant said they might not be able to afford stepping away from their job to get a vaccine if it's only available at certain places and certain times. So of course we know that's an issue for, many families have to work multiple jobs, so they may not be able actually to get away from their work, and that's something that people are in fact quite concerned about. Culture, many of our participants specifically cited the Latinx community in the US. This participant said, the Latino Hispanic population is the largest growing minority, with large numbers of migrant workers and those without citizenship status. Reaching this population, it says pollution, but this population is key, especially as they are being impacted hard by COVID-19. So again, this is something that the general public is concerned about, that there may be a lack of access to the most vulnerable populations. Again, worry that individuals be put on a list, worry that they will have to disclose personal information if they're non-citizens and not know enough about the vaccine, so they're hesitant to receive. So all of these kind of compound and add upon one another to really create increased disparities. And so one thing that we were interested in knowing is, what were community leaders doing? How did people feel about their leaders and the impact on people taking a future COVID-19 vaccine? Our respondents were largely in two categories. One, the huge issue of political division, and the other, a lack of trust, again, in science, in politics, etc. So a lack of trust. So this participant said, because I live in what they meant to say is libtard state with libtard leaders, that they think they know better than everyone else. And so they thought that this was the problem, where another participant indicated that I completely and absolutely do not trust the current political leaders to push for unverified vaccines before November 3rd, 2020. And again, this was prior to the election. So most likely they are talking about the current administration in office, is what it appears to be. And so there's a division really about what people think the problem is with the leadership, coming from a variety of perspectives, not just one side. And I just want to point out that we will discuss, what participants reported, but we're not going to discuss our own personal opinions on a thing. This is literally just what our participants have expressed to us as being concerns. And now I'm going to pass the baton on to my colleague, Dr. Holub, who will be talking about how people's lives have changed since COVID-19 pandemic.
Perfect, thank you so much. So as you've seen, many factors can influence vaccine hesitancy levels, especially with what happens in your personal life, in your family life, but how life changes impact hesitancy really differs by person, and it can be a motivator or a lack of a motivation. And we're all going through this together currently and have our own lived experiences, so we can relate in many ways. But when we asked participants specifically, how has their life changed? Some of the themes that came out were everything, so all aspects. A lot of mention around stress, depression, anxiety, so mental health. And of course, mention of job loss, employment, impacts on income and finances. And then also general health behaviors, exercise being one of them. And so looking at some of the quotes, specifically around just all aspects, one person said, how has it not changed in their life? It has devastated employment, disability service, and every waking hour of our days. Another person said, too many ways to mention, so it changed everything. And then quite literally, all aspects of life have changed. So there were quite a few answers that just had lists saying everything in their life has changed. And there were a few where people might have mentioned, not so much change, but this was one of the most prominent. We also saw a lot around stress, depression, and anxiety, such as this quote. So depression and anxiety have increased. I miss my friends. So thinking about isolation. This next quote has a bit of a duality to it. So poor mental health, along with some coping and good mental health strategies. This one says, a lot of mental health breakdowns with anxiety of the unknown, but also a greater appreciation of knowing what my privileges are because I do not have to worry about employment, housing, having stable internet connection for school, or having a laptop I can use for school, etc. And then some mention of mental health is specific towards COVID. So in this last one, I experience anxiety and panic attacks if I think about COVID too much. So definitely a lot of mention, again, around stress, anxiety, depression. Lots of mention around job loss. Quite literally, I'm out of work. And then here you can kind of see the tie also into mental health. So my mental health is also declining greatly because of isolation, so cannot see friends, family, and the children I work with. Also mention of small businesses and the impact there. And so this next one, jobs have been impacted the most, making it hard to make ends meet. This closure has ruined many small businesses in my family, something they worked their entire lives to create and now has been ruined. So definitely one of the large themes, and as we know from the statistics of unemployment. And I should probably say generally, there's a mix when it comes to health behaviors. Some mention their health behaviors improving, and some mention them getting worse or not being able to do certain things like exercise. So for exercise specifically, as in this first one, so less motivation to exercise, no gym to go to. So we know that has to do with just access. The second one also says staying in a lot more, had less exercise, also having a hard time sleeping, staying asleep, or keeping any resemblance of a normal schedule. But then there's also the contrast. So this person says physical activity has increased with at-home exercises, and then mentions other healthy behaviors. So I've been eating out less and I've lost 4 pounds compared to before isolation. And I would say this was across the board with a variety of health behaviors. So some who are struggling and some who have been able to improve in certain health behaviors. And now when we think about and have asked, so how does it affect family life specifically? Well, a lot of the relationships have changed and they could be for the better, so more bonding. There could be an increase in conflict. And then of course, as you know, just general less contact and isolation. Of course, again, children are at home, not in school. So definitely childcare needs was another theme. So relationship changes. Many people mentioned bonding more with their immediate family, their spouses. This first quote, simply saying closer with my family, spent more time with my 8-month-old son. When it came to conflict, again, mentioning immediate family or spouses. This one specifically COVID related. So arguing over their refusal to take this seriously, it's straining my relationships and stressing me out, being angry and worrying they're going to get sick. And then lastly, again, with isolation. So not being able to see too many people. And when I do, I have fear that I'm exposed myself too much. So relationships change in these different ways. And lastly, as we know, many children are not in school. And as this person said, it's compressed the needs of parents who are also working full time. Children's social health and education have been impacted. So definitely a lot of stress and anxiety there and trying to figure out the balance, which is what the second person mentioned. So initially there's No separation of family and work balance, but now we have found somewhat of a routine. It's still challenging at times, but I would not change anything for fear of contracting the virus. And then kind of a tie in to the bonding, where this person mentions, my kids are enjoying having us home and we have made many new memories and have bonded more. So again, those were kind of the major themes in thinking about how have people's lives, personal lives and family life have changed. What's great about this data set is one of our next steps is to really dig deep into tying in the quantitative and the qualitative. So depending on someone's experience, what is that connection to their level of hesitancy for the vaccine? But for the immediate, it's also very important to understand what coping strategies we can think about in public health to assist with these themes, especially around changes in life and family.
And that brings us to coping strategies. So we're going to talk a little bit about what participants reported as being their coping strategies for dealing with, the kind of the trauma of COVID-19. Many people indicated things like TV, increased TV watching, increased reading, playing games at home, cooking more. I personally have been doing that myself, but also things that may be a little bit less healthy coping mechanisms, such as increased substance use. And the quotes, the qualitative data for the TV, reading, games, cooking was fairly, simple, but there was some really alarming data for substance use. And so this first quote illustrates that, I think, quite well. No lie, if I had access to Adderall or a similar upper, I would use it. Anything to get my mind off focusing on the bleak future. This other participant, maybe joking, maybe not, said not yet, but considering meth. Considering meth and cocaine use. And I say maybe joking and maybe not because, it's said a little bit flippantly, but also it's clear that people are needing something to help them deal emotionally kind of with the trauma that they've experienced through this kind of COVID-19 experience. So it's very useful to know these types of things. We ended our survey with, I think, a really important question, which really allowed participants to just give us their responses about what they want us to know, what they're concerned about. And the most common themes that they came up with on their own was poor leadership, issues surrounding the Trump administration, the anti-vaccination movement, some both pro, some against, and a desire for return to normalcy. That was definitely something everybody wanted. And finally, social responsibility. So we're going to talk a little bit, I'm going to illustrate a little bit of each of these for you because some really interesting comments were made. So the first, poor leadership and lack of social responsibility. This participant said, compared to other countries such as China and Italy, the USA had done a terrible job, from leaders to citizens not cooperating. So, right, it's not just one person's fault in flattening the curve. It is amazing how people do not have the compassion and care for others to follow orders, and how people in this country have a sense of privilege for living in a free country. So concerns about how we're all behaving. Next, we look at, again, leadership and lack of social responsibility. This other person said, I wish that many people in power hadn't ignored the pandemic and seen it as a route to profit. So there's a sense that maybe some people actually profited off this pandemic, which is quite frustrating, right? And finally, quite a few people actually directly cited the Trump administration as being problematic. This participant said, Donald Trump knew things were worse than he told the American people, yet he chose to downplay the situation. He mocks the crisis by not wearing a mask in public and holding political rallies with large crowds. He is to blame for why we are so far behind in getting a handle on this crisis. And that's a quote from one of our participants. Towards the anti-vaccination movement in general. This is kind of pro-anti-vaccination movement. This participant said, I will never take a COVID vaccine, and I believe that 50% of the population will choose not to take the vaccine either. And that's again, a big issue for public health, right? Who is planning on getting the vaccine? Who's planning on not getting the vaccine? And how do we kind of narrow that gap so that more people are vaccinated and protected? Of course, one of the biggest reasons that people, in addition to the health crises, the deaths and the morbidity, mortalities associated with COVID, people want to go back to their everyday normal lives. And so we had quite a few quotes illustrating that. This first participant said, "As much as everyone wants to get back to their daily lives, California opened up way too early, which is exactly why we are closing back or having to close back down again." Another participant indicated, "I do feel that the development and wide distribution of a vaccine is the only way to get us back to normal." So there's a sense that there's action needed so that we can sooner than later return to our lives as we knew it at one stage. And this idea that action is important ties us into the other theme that participants brought up, which was social responsibility. This quote, which I'm pretty sure I divided, is that everyone needs to follow the safety guidelines because people's lives are on the line here. There isn't a political stance to take by not wearing a mask or by not standing 6 feet apart. It's your responsibility and duty as an American to do what's best for yourself and other Americans. So trying to bridge that political divide that we mentioned, many people indicated. So people, please wear a mask, stay 6 feet apart, and stay home as much as possible. I know it sucks, but it's the right thing to do as an American. And that's from one of our participants. So again, the idea that we need to all come together. And with that, that's the data that we'd like to share with you today. We would like to say thank you to all of you in attendance. Thank you to Live Well Advance. To our survey participants, as well as our SDSU research team, qualitative research team, and our CSU San Marcos research team that helped us put the survey together. So we have Jenny, Maggie, Valeria, Gerald, and Jocelyn helping us today on the presentation. So a special thank you to them. And thank you absolutely to our essential workers. You're helping us get through this, and we are so very grateful for everything that you do. Okay, well, with that, I think that we have time for some Q&A. So please go ahead and ask any questions in the chat. I see that we do have a question that we'll start to address. Okay, but please ask any other questions you have or any comments you want to share. I think I saw that Susan raised their hand. I don't know that we have the ability to have you speak, but if you don't mind putting your question or your comment in the Q&A, we're happy to address it. There is one question. Gina asks, curious why quantitative data doesn't show African Americans. And I'll let my colleague, Dr. Morton, who did the quantitative analysis, answer that one. Dr. Morton, do you mind responding? Dr. Morton, are you there?
Sorry, I was talking away and I was muted. So I'm sorry if I wasn't clear on the slide that I had for ethnicity, but yes, we did have some African Americans in the study. We only had 20 of them, and they were significantly different across the three groups of hesitancy. So I thought that they were in that slide, but I'm sorry if you missed that.
Okay, great. And we also have a question from an anonymous attendee. Were there any notable differences between male and female groups for the qualitative data? Oh, great question. So that's actually what we're going to be looking at next. We only did kind of our initial analyses looking at just the qualitative data, but we're going to be quantifying the qualitative data and then performing some actual differences like analyses, statistical analyses, looking at differences between groups like male, female, non-binary, looking at race and ethnicity groups, and a variety of other categories. Excellent question. And Susan says, there's a difference between the Pfizer vaccine, which is an mRNA vaccine, and other vaccines. Do you think that most Americans know the difference, and which type of vaccine would they feel safer taking? Oh, Susan, that's a huge question and a great question. I'm not sure that we have the answer to it. I mean, I'll let my colleagues respond as well. We didn't specifically ask about that, but we are going to be launching a follow-up survey, another wave that we will be asking more questions about. So I think that's definitely something that we can specifically address in future surveys.
I also think that, this is Dr. Morton here, I also think that there's a lot of education going on the news, on some news anyway, about the mRNA vaccines. But I think it's extremely complicated and a little bit hard to understand. So I'm not sure that many people know the difference.
Agreed. Any other questions? We're happy to answer. Susan says, thanks. There has never been an mRNA vaccine given before. That's why it needs to be stored at very low temps, which is hard for doctors' offices to administer. So it will be definitely, Susan, I agree, very interesting to see what happens and what vaccines, plural, may come out. And that's something that we'll definitely be interested in looking at. I imagine that we will have more than one follow-up wave of data to kind of look at how things are changing over time, and how people's perceptions and the likeliness of taking a COVID-19 vaccine when it's available does occur. Thank you for those wonderful sets of questions and comments. Lisa asks, did any of the participants have underlying health issues or comorbidities? If yes, do we know which ones? And I'll let Dr. Morton answer that, as she has been sorting through the quantitative data.
No, we did not ask those questions if they had underlying conditions. We did ask if they had the reasons that they may not be someone who can get a vaccine, such as allergies to different things, but we did not ask whether they had underlying conditions. And that's a very good question. So I'll make note of that, and maybe we can add that into our next round. Thank you.
Absolutely. And Gina has a follow-up question. Of the 20 African Americans, did they seem receptive to taking the vaccine? Did you see a difference there, Dr. Morton?
That has not been analyzed yet. We have not done that stratification. So sorry about that.
We have a huge data set, everyone, and we have lots to analyze. But as Dr. Morton mentioned, we closed the survey, what was it, beginning of November or something? It seems so long ago now. So we've only been kind of crunching the numbers quickly recently, but we're going to spend the next few months really digging down into to try to answer all of those really important questions. Are there any other questions or comments or suggestions for future surveys? We're definitely, they're in the works, follow-up surveys, and it will be reaching more populations as well. So any suggestions will be appreciated.
I was going to say that it's great to hear the questions to better inform the future survey. So thank you everyone for your questions.
Okay, well, Susan says, fantastic presentation and very relevant, highly relevant. Oh, thank you so much. We've really enjoyed working on this, and we're super excited to continue our work. So thank you all for attending and being part of this and helping us better our research. We're very excited to see, how things are evolving over time.
Yes, thank you, everyone. We appreciate your attendance and all of your questions. So we hope that maybe next year we'll have more information. And if this comes across your email at some point in time, the survey, please take our survey. And
yeah, be on the lookout. We're going to be coming for you.
Yeah,
absolutely. Thank you all so much.